ADHD is a treatable disorder. With the right treatment, people with ADHD can live happy and fulfilling lives. Studies using brain scans have shown that individuals with ADHD often have differences in brain structure and function, particularly in areas related to attention and impulse control. Hi everyone, and welcome to Learn to Profit. Today, we're talking about how ADHD is diagnosed and treated. ADHD, or Attention Deficit Hyperactivity Disorder, is a neurodevelopmental disorder that affects about 6% of children and 2% of adults. It is characterized by difficulty paying attention, hyperactivity, and impulsivity. Diagnosis: ADHD is typically diagnosed by a mental health professional, such as a psychologist or psychiatrist. The diagnosis is based on a detailed assessment of the person's symptoms, including their medical history, family history, and behavioral observations. There is no single test to diagnose ADHD. However, there are a number of rating scales and questionnaires that can be used to assess the symptoms of ADHD. The most commonly used rating scale is the ADHD Rating Scale IV-ADHD-RSIV. This assessment may include clinical interviews. The clinician gathers information from the individual and their family regarding symptoms, medical history, and daily functioning. Behavioral observations. The clinician observes the individual's behavior, looking for signs of hyperactivity, impulsivity, and inattention. Questionnaires. Standardized questionnaires, like the ADHD Rating Scale, are often used to assess the severity of symptoms. School and work records. Information from teachers, employers, or educational records can provide valuable insights into the individual's behavior in different settings. To be diagnosed with ADHD, a person must meet certain criteria, including having at least 6 symptoms of inattention or 6 symptoms of hyperactivity impulsivity for at least 6 months. Having symptoms that are present in 2 or more settings, such as at home and at school. Having symptoms that are severe enough to cause significant impairment in daily life. Chapter 3: ADHD Types and Criteria. ADHD isn't a one-size-fits-all condition. It comes in different types, and diagnosis depends on meeting specific criteria. The 3 primary types are predominantly inattentive presentation. This type is characterized by primarily inattentive symptoms, such as difficulty organizing tasks, forgetfulness, and trouble focusing. Predominantly hyperactive impulsive presentation. This type is marked by hyperactivity and impulsivity, with fewer inattentive symptoms. Combined presentation. This is the most common type, where individuals exhibit a combination of inattentive, hyperactive, and impulsive symptoms. Treatment. The treatment for ADHD typically involves a combination of medication and therapy. Medication can help to improve attention, reduce hyperactivity and impulsivity, and improve mood. The most commonly used medications for ADHD are stimulants, such as methylphenidate, Ritalin, and amphetamine Adderall. Therapy can help people with ADHD learn coping skills to manage their symptoms. Therapy can also help people with ADHD build self-esteem and develop relationships. There are a number of different types of therapy that can be helpful for people with ADHD, including behavioral therapy. Behavioral therapy is a type of therapy that focuses on changing specific behaviors. Behavioral therapy can be helpful for people with ADHD learn coping skills to manage their symptoms. Cognitive behavioral therapy (CBT) is a type of therapy that helps people identify and change negative thoughts and beliefs. CBT can be helpful for people with ADHD build self-esteem and develop relationships. Parent training. Parent training is a type of therapy that teaches parents how to manage their child's ADHD symptoms. Parent training can be helpful for parents of children with ADHD. ADHD is a lifelong condition, but with proper treatment and support, individuals can lead fulfilling lives. Long-term management involves regular follow-ups with healthcare professionals, adjustments to treatment plans as needed, continued support from therapists, teachers, and families, building skills to navigate challenges effectively. If you or someone you know has ADHD, please reach out to a mental health professional for help. With the right treatment, people with ADHD can live happy and fulfilling lives. Here are some additional tips for people with ADHD. Get organized. Create systems and routines to help you stay organized. This could include using to-do lists, calendars, and reminders. Break down large tasks into smaller tasks. This will make the tasks seem less daunting and more manageable. Take breaks. Get up and move around every 20-30 minutes to avoid getting too restless. Find a quiet place to work if possible. Find a place to work where you will not be distracted. Ask for help. Don't be afraid to ask for help from your family, friends, or teachers. If you are struggling with ADHD, please know that you are not alone. There are many people who have ADHD and live happy and successful lives. With the right treatment and support, you can too.